What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video we're covering when is it necessary to use a grid slash virtual grid when you're exposing to get the most best optimal images, which that is our goal with pertaining to a LARA. So to give you context, I'm a night shift tech. I've been doing it for 4 years. Work a lot of overtime, dabble in day shift too. So the grid situation, some you actually have to physically put a grid on your actual cassette. Other ones have a virtual grid, which you just like on your portable machine, you just click virtual. All this is kind of subjective because everyone's portable machines kind of work different, and certain ones shoot hotter. Certain everything's kind of niche. So over time, or maybe asking your veteran techs who's been there, they can kind of give you better I guess niche situations when it's better to use what. So I'll just give you context for what from what I've learned, because I have two machines, identical. They're both Fujis, and one it shoots better if you shoot it with the grid already versus the other one you shoot it without a grid and then slap a grid on it and the picture comes out better. So it's weird because one, you have to shoot it hotter, and then there's less it's harder to manipulate the image, versus the other one you shoot it lower, but then with the virtual grid it can compensate and make it better. And then there's more wiggle room to connect. It's kind of a double-sided sword. What I have learned is if a patient has a prosthesis, shoot it with the grid every time and shoot it a little bit more hotter, because usually, especially if it's older patient, the prosthesis, it will always burn out the picture and it's harder to get the good images. That's kind of one thing that I've noticed, both from asking techs and from shooting a bunch of old people or people with prosthesis. You have to be certain stuff. Certain machines are better, situational based. Sometimes it'll show up and it'll recommend hey, you should put a grid on this. You're doing blah blah blah. Or it'll give you advice, or depending on the readout you have, ours is the SI number. Ours is 200 is the optimal number. So depending on what we see, you kind of work around it. And then there's other techs that want to get the most optimal number, but reshoot it several times. Me personally, I would even if the readout number isn't perfect, but the image looks okay. Sometimes it's almost, the readout number is kind of a suggestion, because sometimes the picture will come out and you look at it and it'll be good, and then the readout maybe will be off, and I'm well, there's no point in me reshooting the patient to getting this one optimal. Other times the readout will be good but the image doesn't come out good, so it's kind of a iffy situation, I guess, depending on what the patient has going on and your machine. So it's kind of a double-sided sword. So all that stuff comes with time and running your machines and patience and stuff, all that just come with time. It wasn't until I was as a student, I was lost completely as far as the dosage and all that, because machines will have a set amount recommended, and then you kind of tweak from there. It's the baseline, but certain stuff you'll have to tweak a lot more compared to other ones. For instance, our shoulders, I think it spawns in at 7 at 2.5. And usually, even unless they're petite, you shoot it at that. Usually, you have to bump it up at 7 to 5 or 7 kVp, and then for the Y, it's 7 something at 14. There's a big dramatic change, because I guess the default isn't optimal. So all that's kind of subjective, and with time you get better at it. It's just giving you advice. And yeah, it's been your boy Miguel. See you on the next one.